Hello and welcome to the topic Generalized Anxiety Disorder or GAD in the Psychiatry module. By the end of this topic, you should be able to define Generalized Anxiety Disorder or GAD, explain the types of GAD, explain the pathophysiology and causes of GAD, describe the clinical manifestations of GAD, outline the assessment to diagnose GAD, and finally discuss the management of approach of GAD. Let's get started. Generalized Anxiety Disorder or GAD is a mental and behavioral disorder, specifically an anxiety disorder that is characterized by excessive, uncontrollable, and often irrational worry about events or activities. Worry often interferes with daily functioning, and sufferers are often overly concerned about everyday matters such as health, finances, death, family, relationship concerns, or work difficulties. This ongoing worry and tension may be accompanied by physical symptoms such as restlessness, feeling on the edge or easily fatigued, difficulty concentrating, muscle tension, and problems sleeping. So, what are the 5 major types of anxiety disorders? Let's begin with generalized anxiety disorder, which is the topic we'll be discussing here, which is an anxiety disorder characterized by chronic anxiety, exaggerated worry and tension, even when there's little or nothing to provoke it. Next would be obsessive compulsive disorder or OCD. It's an anxiety disorder and is characterized by recurrent, unwanted thoughts, obsessions, and or repetitive behaviors which are known as compulsions. Repetitive behaviors such as hand washing, counting, checking, or cleaning are often performed with the hope of preventing obsessive thoughts or making them go away. Performing these so-called rituals, however, provides only temporary relief, and not performing them markedly increases anxiety. Next would be panic disorder. Panic disorder is an anxiety disorder and characterized by unexpected and repeated episodes of intense fear accompanied by physical symptoms that may include chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. Next would be post-traumatic stress disorder or PTSD, which is an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. Traumatic events may trigger PTSD include violent personal assaults, natural or human-caused disasters, accidents, or military combat. Finally, we have social phobia or social anxiety disorder. Social phobia or social anxiety disorder is an anxiety disorder characterized by overwhelming anxiety and excessive self-consciousness in everyday social situations. Social phobia can be limited to only one type of situation, such as a fear to speaking in formal or informal situations, or eating or drinking in front of others. Now let's take a quick look at the pathophysiology and causes. So the brain circuits and regions associated with anxiety disorders are beginning to be understood with the development of functional and structural imaging. The brain amygdala appears key in modulating fear and anxiety. Patients with anxiety disorders often show heightened amygdala response to anxiety cues. The amygdala and other limbic system structures are connected to the prefrontal cortex regions. Hyperresponsiveness of the amygdala may relate to reduced activation thresholds when responding to perceived social threat. In the central nervous system, the major mediators of the symptoms of anxiety disorders appear to be noradrenaline, serotonin, dopamine, and GABA-aminobutyric acid or GABA. Other neurotransmitters and peptides such as corticotropin releasing factor may be involved. Peripherally, the autonomic nervous system, especially the sympathetic nervous system, mediates many of the symptoms. If we're talking about etiology, you may want to consider substance-induced anxiety disorder, which is over-the-counter medications, herbal medications, substance of abuse, which is a diagnosis that is often missed. Another possible etiology would be genetic factors, which significantly influence risk for many anxiety disorders. Environmental factors such as early childhood trauma can also contribute to risk of later anxiety disorders. Some individuals appear resilient to stress while others are vulnerable to stress, which precipitates an anxiety disorder. And lastly, the psychodynamic theory has explained anxiety as a conflict between the ID and ego. So aggressive and impulsive drives may be experienced as unacceptable, resulting in repression. Common physical signs of generalized anxiety disorder include tremors, tachycardia, tachypnea, sweaty palms, and restlessness. Typically, children and adults with generalized anxiety disorder also experience uncomfortable physical symptoms including rapid heartbeat or palpitations, feeling shortness of breath, increased sweating, stomach cramping, a frequent need to urinate, dry mouth, nausea, diarrhea, headaches, neck or back aches, or a feeling of nervous tension. So one may have generalized anxiety disorder if the specific signs and symptoms are present for 6 months or more and on more days than not. These include physical symptoms as well as excessive worrying to the point that everyday activities like working, studying, or socializing becomes difficult. So we can use a symptoms checklist to assess the presence of these symptoms for 6 months or more or on more days than not. If they have felt worried about a number of events or activities, found it hard to stop worrying, and found that anxiety made it difficult for one to do everyday activities. If one has answered yes to all of these questions, and they've also experienced 3 or more of the following symptoms, which are feeling restless or on the edge, felt easily tired, had difficulty concentrating, felt irritable, had muscle tension, and had trouble sleeping, then one may be experiencing generalized anxiety disorder. When the index of suspicion of anxiety being produced by a medical disorder is low, where there is lack of physical findings or younger age, typical anxiety disorder presentation, initial lab studies might be limited to just a full blood count, probably a chemistry profile, thyroid function test, urine analysis, and urine drug screen. For presentations with a higher index of suspicion for other medical causes of anxiety, more detailed evaluations may be indicated to identify or exclude underlying medical disorders, and these are examples tests for infections. So you may want to rule out infectious causes using rapid plasma reagent test to look out for syphilis, a lumbar puncture to look out for CNS infections based on the CSF analysis, or an HIV testing to exclude HIV infection. An arterial blood gas analysis is useful in confirming hyperventilation and excluding hypoxemia or metabolic acidosis. Electrolyte analysis is unnecessary, although several abnormalities may be present in the setting of hyperventilation. So you may expect to see serum phosphorus and ionized calcium being diminished in patients with hyperventilation. They would be presenting with carpopedal spasms, Chvostek signs, or to the Trousseau sign. The serum calcium level may be within the reference range, nevertheless. As for thyroid function tests, hyperthyroidism is one of the most common medical causes for anxiety related to a medical condition. So serum thyroid stimulating hormones and T4 levels should be considered for excluding a primary thyroid abnormality. Now let's move on to imaging and functional studies. Here we want to do electroencephalography or EEG, a lumbar puncture and head or brain imaging which helps us rule out CNS disorders, electrocardiography or ECG which helps us rule out cardiac disorders such as myocardial infarction. A chest radiograph is useful in excluding other causes of dyspnea with chest pain. Treatment usually consists of a combination of pharmacotherapy and/or psychotherapy. So you may also want to know the indications for hospitalization, which are severe functional impairment, if there's any risk of suicide or homicide, having social skills deficits, as well as emotional intelligence being assessed. For pharmacotherapy, you may begin antidepressant agents, which are the drugs of choice in the treatment of anxiety disorders, particularly the newer agents, which have a safer adverse effect profile and higher ease of use than the older tricyclic antidepressants such as selective serotonin reuptake inhibitors. Antidepressants that are not FDA approved for the treatment of given anxiety disorder, such as nevazodone and mirtazapine, still may be beneficial. For psychotherapy, you may consider behavioral therapy and cognitive behavioral therapy, which have demonstrated efficacy through controlled studies. Then we also have the computerized CBT, or known as the Fear Fighter, and has been recommended for panic and phobia by the National Institute for Health and Clinical Excellence guidelines. Psychodynamic therapy is rarely indicated as an exclusive treatment for phobias and is now mostly used for cases of phobic disorders that overlap with personality disorders. And finally, we have interpersonal psychotherapy, which has also shown some efficacy. So to conclude, generalized anxiety disorder is a disorder where there's persistent and excessive worrying. Anxiety disorder itself can be categorized into 5 types, which are generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and phobias. We have looked at the pathophysiology and causes for generalized anxiety disorders, the physical signs and symptoms to look out for, what are the roles of investigations in terms of excluding a medical condition, as well as the approach of treatment to generalized anxiety disorders, which include a combination of pharmacotherapy and psychotherapy. We have come to the end of this topic. Thank you.